Almighty King of glory, we adore you and exalt you for who you are. Thank you, Lord, for the privilege of being here. Thank you for your faithfulness, for your grace and mercies upon our lives. Thank you for all the stakeholders that are gathered here this morning for this event to mark the World Health Day 2026.
I want to thank all of you for coming, and I believe that we are going to pass the right message. Distinguished guests, members of the press, ladies and gentlemen, good morning all. Thank you very much for this opportunity. Indeed, on behalf of the government and people of Plateau State, ably led by our dear leader, the leader of the time is now administration, someone that is very passionate about health matters on the Plateau, His Excellency Barrister Caleb Manasseh Mutfwang. I want to sincerely thank the entire people of Plateau, particularly those of us involved in health matters. Quite a lot of us have been contributing very significantly to ensure that the health of our people is protected, that people receive the best of care, whether at facility level and even for public health enlightenment. The importance of the theme for this year cannot be overemphasized. Together for health, stand with science. This to us is a clear demonstration of the fact that whether you are a health personnel or not, anything health should concern you. And so whether from the primary to the secondary to the tertiary levels of care, all of us are involved. Our communities, our traditional rulers, our religious leaders, everybody should be an advocate for health. And as a state, we must also gear up to take up the responsibility. And I'm happy to say that in the last few months, we've had a lot of engagement with our partners, supported, and various actors in the health system on how we should integrate our services to reduce costs and to manage the little that we have. Service integration can no longer be something we should take lightly. And because of that, we are looking at how not only HIV/AIDS, TB, malaria, but now other diseases should be integrated to be working together so that when we are going for public enlightenment, instead of going for one item, why can't we do all of them together? And so I want us to take up that challenge. We sincerely appreciate what the public health physicians and other public health practitioners are doing in the state. Our partners have been very, very supportive.
Our keynote speaker, Dr. Magaji Iza, MBBS, MPH, Master Trainer, enthusiastic biostatistical trainer. Thank you very much.
Thank you so much. It's indeed an honor for me to be the keynote speaker in this very event. And I will be explaining a lot of things, practical things in the public health space that will drive us through the sub-theme of the day, which is harnessing government and development partners' effort towards achieving universal health coverage in Plateau State.
Welcome, Professor Esther Mbuladu, the anchor of the panel. Please put your hands together for Professor Esther Mbuladu.
You're welcome, ma'am. You're welcome, ma'am. She's going to be sitting right here in the center.
You're welcome.
Thank you for clapping and keep clapping.
Thank you.
All right.
My esteemed panelists, spare me the trouble of having to call you because I will call you later. My dear colleagues in the health profession, good afternoon, everyone. It is my pleasure to welcome you to this very important panel discussion titled Harnessing Government and Development Partners' Efforts towards achieving universal health coverage in Plateau State, to ensuring that every individual can access quality health services without financial hardship. Yet, despite ongoing efforts, as we've heard in the course of this event, access to equitable and quality healthcare in Nigeria remains uneven. It is shaped by persistent challenges in financing, workforce distribution, and service delivery.
The heads of agencies, heads of development partners who are here, so many of them, CMDs that have come, directors of the of the State Ministry of Health, heads of association, and of course the members of all these associations and agencies that are present with us, members of APHPN and Plaskema, and also the members of the media who have been with us since 7 o'clock in the morning. And clearly today, I believe that something has been achieved. And what we have done here today is to show the value of actually working together. And we are hoping that with what has been outlined today, that we have seen an urgent need for stronger collaboration, for evidence-based decision-making, and for sustained investment in public health systems. I am very particularly pleased by the actionable recommendations that were made at the end by both the keynote speaker and the anchor for the panel. And we are hoping that as APHPN, we will be able to remain committed to working with all our stakeholders to translate these deliberations into measurable actions. So today a marriage has been done, and we hope that going forward, the conversations that we have had in this hall will not end here. Let us take them back to our institutions, our communities, our spheres of influence, and collectively drive the changes that we desire to see in our health system here on the plateau.
My name is Dr. Magaji Ajik Izan. I'm the State Coordinator, National Primary Healthcare Development Agency. We are gathered here to commemorate the World Health Day, which is celebrated on the 7th of April. But we have decided to have the celebration by having a panel discussion to discuss some of the ways Plateau State can be able to speak of the team, which is Together for Health, standing with science. And we'll be talking about harnessing government effort and partner coordination towards enhancing universal health coverage. Because with that, we will know that we work together, both government and partners, to enhance the health system in Plateau State beyond just numbers, but let's touch the lives of our people so that we will ensure that our people get the quality health care they require and without any financial hardship. So basically, this is why we are here. We are made up of government, parastatals, agencies, development partners, WHO, UNICEF, life helpers. A lot of partners are here so that we can showcase and celebrate the World Health Day on the Plateau.
Professor Chundung Maina, I'm the chairman of the Association of Public Health Physicians of Nigeria, and today we've organized a program to mark the World Health Day of 2026, and the theme for the year is Together for Health, Stand with Science. And this program today is going to entail a health walk and also a symposium where we'll be discussing how we can collaborate to achieve universal health coverage within the state. And the program has brought together stakeholders from different sectors, including us as an association, the state government, World Health Organization, which along with its other partners, and also the academia. And we're going to have a panel discussion apart from the keynote presentation, where we will discuss what we can do as a state to move the health forward. What we are hoping to achieve is that there will be unity in the work that is ongoing in the health sector rather than disjointed plans. Already the state has actually been moving in that direction, so we are playing our part to ensure that this move, the tempo is maintained, and so that we can work together to be able to achieve a universal health coverage for Plateau State, or at least to improve what we currently have.
Today, we are continuing what we started on the 7th of April, which was the day we marked the World Health Day. We had the press conference then, but we are also continuing that process by ensuring that we organize this health walk and having a symposium organized in collaboration with the Association of Public Health Physicians of Nigeria and the PLASCHEMA and a host of other partners that are here. And so we want to enlighten the public more on the essence of the World Health Day, which we all knew the theme, Together for Health and Standing with Science. Again, emphasizing the fact that all of us are together when it comes to health matters. We must collaborate. We must ensure that everybody from the community to those of us in government, that we ensure that everybody gets involved in health activities for the time going forward. So also the importance of science as it relates to how people should do best practices, particularly as it relates to diagnosis, as it relates to treatment, as it relates to even preventive measures, that all of this is a product of science. And so science has ensured that we achieve most of what we are achieving today in terms of health activities, whether it's immunization, whether it is whatever aspect of health that we are looking at. And so today especially we decided that we are going to continue this activity, but after today of course we would have ended marking the World Health Day 2026 as a state.